Hello, I'm Tina Jennings. Therapy Group of Tucson is back with us today, and we are going to focus on voice disorders and how they can affect the frequency, the loudness, or the quality of the sound when speaking to others. Speech pathologist Kyle Meades is here to tell us what the most common types of voice disorders are. And Kyle, we always kind of tackle kind of a different topic. So today being voice disorders, what really are they?
We're always talking about something.
Yeah.
Even before the show, we're sitting here chit-chatting, and we're always talking. Now, you know, when I come on the segments, I'm either talking about speech problems or language problems or certain problems like autism or Down syndrome. Today I'm going to talk about voice disorders, and voice disorders affect your actual voice generator, your larynx. It's right here in your neck behind your Adam's apple, and that's what produces your voice. And it can, if there's a problem with the voice, you'll have problems with pitch or your loudness or your quality of in the way you sound. Yeah.
So unlike maybe some of the other stuff that we've talked about that is maybe mental or something maybe that you're born with, what are some of the causes that can really do this to someone?
Yeah, this is a lot different. You know, we see a lot of kids and adults in our clinic, and we get a lot of referrals from doctors. One of those specialists is called an ENT, an ear, nose, and throat physician, and we get calls all the time. Can you schedule a patient? They have a voice disorder. And a lot of families and patients come through that ENT doctor, and they look at the actual, they take a picture of the vocal cords and they send us that picture, and we're able to see what the voice looks like. And when you look down in the throat, you have a left cord and you have a right vocal cord. And sometimes those cords get inflamed, they get red, and that can affect the overall pitch or quality of the voice. And so it's the job of the speech pathologist to fix that. And sometimes people come to me and say, hey, you know, I just don't sound natural, or my voice is breathy, or I just don't sound normal, my pitch is off, you know, I'm breathy. Those are some of the types of problems that we see, and we do this all the time.
And so we were, as you're saying, we were just chit-chatting before the segment,
yeah,
but
always.
We were talking about everything from people that maybe talk a lot in their jobs, or even maybe a younger person that spends a lot of time at bars or places with loud music, or people that smoke around them. There's so many environmental things.
Or even reflux.
Yeah.
You know, a lot of times people who have problems with their voice also have problems swallowing foods and fluids too, because again, the first job of the larynx is not just to produce voice, but to protect our airway when we swallow foods and fluids, to keep that from going down into the lungs. So the voice is a complex instrument, and so we have to take care of our voice. So when someone comes to us, we do a complete voice evaluation, we listen to the pitch, we talk to the patient. Again, your voice is always telling on you. It can tell you your health, it can tell you your gender, it tells you everything about you. It's you. And so we do that evaluation, we take the information from the ear, nose, and throat physician, and we formulate a treatment plan. And the treatment lasts normally about 6 months, and we work with the patient on identifying the problems how they use their voice inappropriately. Again, some people speak too loudly, some people speak too much, some people throat clear, and when you throat clear, people think, oh, the throat clear, that's going to make my voice better. I'll just clear my throat and my voice will come right. Yeah. But actually, that's the worst thing you can do, because it slams the cords together, increases the blood flow to the larynx, and your pitch drops. And so you get into a catch-22 cycle.
Wow. You know, and a lot of people, even someone that works here on the show, has really bad allergies, and that causes him to constantly clear his throat.
Absolutely.
And now we're knowing what it's doing in there.
And that'll cause a hoarse voice. Sometimes people with bad allergies or asthma, they're on an inhaler, and sometimes even taking the inhaler in without a spacer can cause voice problems too. There are many things that can cause voice problems.
And I know you had mentioned also, you know, prior to starting this interview, is you said somebody might say, you sound sick, but you're like, oh, I feel fine.
Exactly.
Like, you know, that might be an indication, like, oh, maybe even if you can't hear it, if other people are starting to pick up on it, maybe that's something to get look into.
Absolutely, because some people come to our office and they're depressed and they're sad and they're down, and because people are treating them and responding to the way they sound, and they'll say, hey, you sound sick today. Well, I'm really not sick. It's just my voice is weak. You know, I sound weak. I sound sick. I sound unhealthy.
Yeah.
So your voice really does tell on you, and you can't fake it.
Well, how do we then keep our voice healthy? I know you were saying like not clearing your throat.
Not clearing your throat, staying hydrated, and especially in our environment here in Tucson, it's a very dry climate. You want to stay hydrated. Again, you don't want to cough and throat clear. You want to watch how much you speak during the day. If your voice starts to hurt, especially this time of the year when people have colds and allergies and flu-like symptoms, you have to watch the way you cough. A lot of times when you cough, you can actually damage your voice too, but you want to use a breathy H, like a kind of a way, because it's like a little puff of air underneath the vocal cords, so the vocal cords won't slam together. Those are some things you can do.
Now, if someone is saying, okay, that sounds like me, I'm going to go through all of these steps to see if maybe I can get some help from you guys, I'm sure they're asking if their insurance might help with that cost of getting the therapy.
Yeah, the cost of care normally in voice treatment and voice evaluations is covered because it's a actual problem with a part of the body, so yes. And also too, you want to go to your ear, nose, and throat physician and get that ENT clearance before you come to the clinic. That way the ear, nose, and throat physician can look into the throat and see if there's something else going on. And
then we of course saw all those smiling faces at your center, so people will be waiting to help you.
Absolutely.
Well, it was so great to sit down with you one more time before the year ended, and of course somebody, thank you so much. Somebody can start 2017 off with a beautiful voice.
Healthy voice. That's right.
You at home can schedule a speech and language evaluation by calling Therapy Group of Tucson at 232-2021. For more information, also log on to supportvoice.com.